throw some good curveballs in there.
All right. So what is your job title?
My job. So shall I?
I don't care.
My job title is Regional Sales Manager.
Okay. And what are some of the tasks you do daily?
I do administrative tasks and such as I allocate resources to my team of representatives for programs, for samples, and other resources needed to fulfill their job on a regular basis. In addition to that, I go out in the field with them and call on customers, providing feedback, coaching to my representatives, and trying to answer questions or find solutions to problems of our physicians.
So out of those, what are like the most important activities you do in a day?
Probably would be coaching my sales representatives, giving them feedback on how to do their job maybe better, or looking at different ways to provide resources to our customers.
Okay, and what are some problems or challenges in this type of work style?
I would say the challenges are the access to the actual customer. So physicians becoming more and more busy, having to see more patients in a day. So actually getting FaceTime with them to discuss our products or to help provide solutions, it's becoming more difficult to just actually meet them and have a lengthy conversation. So usually it's can be quite quickly that we have to get our information out.
So you have a short amount of time with your vicinity?
Most commonly, yes, probably anywhere from 3 minutes or less. When we would like to get more time, so we would schedule lunch to capture more time. But yes, it's limited time.
Okay. And what are some benefits of this kind of employment?
I like to think that we're out offering, patients improvement in their quality of life. Our products or pharmaceuticals can be very beneficial to someone suffering from various types of disease states like Parkinson's disease or a muscle spasm. My products help that patient either relieve or completely eradicate or get rid of the symptoms that they're suffering from.
All right, so do you learn about your products and then you sell them to doctors' offices? Is that what you do?
Correct. Yeah, we get trained on the products, know the science behind the product, how they work, and then what patients are appropriate for the doctor to consider our products.
So is that your required training for your job?
Yes.
Okay. And then what are recommended training? Like what do you recommend for training and education for this job?
I would strongly encourage probably like a science background, learning about the body, physiology, microbiology would be very helpful in preparation for this field. It would give you a strong foundation or basis to continue to learn and understand the products themselves.
Alright, and then what are some entry-level jobs that you would think could lead up to this position?
I would think any direct business-to-business selling to fine-tune or to become familiar with the selling skills necessary to be successful. That could be anything from selling copiers, retail sales, that allow you to perfect or fine-tune or get comfortable with the selling cycle.
Alright. And what are some special skills that you need for your job?
Leadership. I think you need to have some business acumen, being able to look at where your business is coming from, where you're losing it, and how to go about recapturing business.
Alright, and so then what are some recommended high school education? Like what would you recommend for high school?
I would definitely focus in on sciences, or if there's human anatomy or physiology classes that you could take, I think that's very beneficial. Learning and understanding how the body works, science about what chemicals or compounds work, or how they interact in the system and the body itself can be very beneficial.
And do you use any technology on a regular basis?
Absolutely. Laptop, iPad, WebExes. So yes, technology has become we use that on a daily basis.
All right. And do you have any advice for people trying to get this job?
Yeah, I mean, if they have a desire and want to get into pharmaceutical sales, again, if they have that science or background with sales skills, I think that they can feel comfortable pursuing this career. I like it because it's cutting edge. Drugs are always changing. We're always looking for hopefully cures or at least drugs that slow the progression of disease states. So if that's something that's appealing or enticing to people, I would say that it's a very worthwhile career.
Okay. And is there anything that you think you could do in your job in education, like continuing your education for this job?
Yeah. So we are always, so if we get a new product that comes to market, we are required to go back through training specifically on that product. And it's usually anywhere from probably 6 to 12 hours of intense study, reviewing, again, neurotransmitters or the brain, where this drug works, what the side effects are, what the risk and benefits to the product are. So yes, ongoing training and learning is a constant in my job.
All right. Thank you very much.
You're welcome. I love my kids screaming in the back.